Okay. The lymphatic system is our so-called sewage system.
Oh.
If our blood circulation is our highway, all the runoff of the highway and of the streets into the drainage system, into the gutters, into the sewage, is our lymphatic system. It's going to take all this debris, run it into the lymph nodes, which is like a water treatment plant. It's going to filter all of the debris out. It's going to sanitize the fluid so that there's no bacteria and viruses in there. And then it's going to send it on to the next power plant up the chain. It gets filtered and filtered and filtered until it's clean, coming back into the blood system up near the heart, and then it's going to go back into the system so that we reuse what our body has. We don't want to keep dumping fluids, dumping waste out, because that's not efficient. So the purpose of the system is a network of tissues and organs to rid the body of toxins, waste, and unwanted material. So this is going to transport lymph fluid that contains these white blood cells throughout the body that help fight infection throughout the body. Okay, so imagine like Navy SEALs underwater in the sewage system, mucking around to just to figure out if we have any sort of enemies trying to come down in the sewage system. Okay. So, remember we talked about blood, plasma. We got plasma, then we got red blood cells, and we got platelets and white blood cells. Okay, this plasma, this clear kind of fluid, this fluid, once it goes out of the walls of the vessels, so the vessels are semi-permeable, once it leaks out of that vessel, then it's going to go into interstitial tissue, so in between the cells. This fluid is going to then become interstitial fluid, right? So the rain's coming down onto the street. As the rain floods the street, that water has to go somewhere, and it's going to go into the drain. Once it goes into the drain, into the lymph ducts, then it's going to be lymph fluid. So you see how it all derives from plasma, and it changes its name depending on where this fluid is in the body. So these little openings here, these are like the drains, the gutters on the side of the street. All the McDonald's cups and leaves and debris and all this stuff goes into that system with the water. And then once there's enough pressure here from the interstitial fluid, you see these cells here, the fluid in between, once it swells, then this flap is going to open up, and this fluid is going to come in here, and it's going to drain through these lacteals into the lymphatic system, and then work its way up to the first water treatment plant to get filtered, which is the lymph nodes. Okay, so like I said, it's similar to the veins and capillaries of the circulatory system, and this is just going to filter out from that system into the lymphatic drain system.
So goes into the sewage system, it moves out to the bulk water filtration plant. It gets filtered, and then what happens to it?
Then it goes to the next filtration plant. Every little node in this green area is a lymph node, every dot. So it goes to the next plant to be filtered, because maybe this first plant missed some things. So it goes to the next one, that gets filtered. Maybe that missed some things. Then it goes to the next one. Depending on how much debris is being put in there. Imagine you taking your Brita pitcher, going outside and dipping it in the mud. It's going to take more than one cycle to get that water clear. So this is what is happening here. It's going to the next one, going to the next one, but it's going up the chain towards the heart. Once it reaches the heart, that fluid should be like clean, and then that fluid goes back into the system to be used again. So here's another example. You got your arterioles, then you got your blood capillaries and your venous capillaries, your venous system there. So as this portal is transporting fluid back up to the system, all of these spaces in between, these tissue cells in between, are being filled with fluid, right? This plasma becomes interstitial fluid. Then when the pressure builds enough, in the green here, these little flaps, remember, things go from high to low pressure. So it's going to push open the doors, and the fluid is going to go into these ducts here. So once it's in the lymph veins, then it's going to be lymph fluid. Then it's going to go from the veins into the ducts, and then from the ducts into the large system. So just like you have your air ducts that come out into each room into smaller ducts and then come out the vent, this is going to go backwards into the larger system and then be pushed back up into the main system where it's clean and then pushed back out again. So this lymph node is similar to a Brita filter. All these sections here, these little cortexes here, these are going to filter all the fluid, all the debris, all the viruses, all whatever. And they're stored white blood cells in the system to help fight infection so this area doesn't get overrun. So when somebody has an enlarged lymph node in the neck, that means this area is being infiltrated and the enemy is trying to take over this one base. And we're fighting and fighting and fighting, and then there's inflammation and irritation, so then those glands can get swollen. Because this virus is coming into the cell, it's replicating, so it's making more of itself, so the body is not only fighting the viruses that are already in the body, but also the viruses that are being dormant that are replicating. So like there's like a whole onslaught of things going on, and this area is just being overrun at the moment. So then that's when they get swollen. But as you know, if you have little kids, like they'll get swollen, and then a couple of days later, it'll go down because the body is successful in fighting the infection. So there are hundreds of these lymph nodes in the body. They are around vital areas, as you can see, the lungs, around the heart. They're going to be in the abdomen. They're going to go down each shoulder into the armpit down to the arms. So to supply any sort of finger cut that you cut your finger on a nail, all that rust and stuff, all that is going up towards the heart. It's going to catch it before it gets there. It's going to go down into the inguinal area in the groin and going down behind the knees and then going out to the feet. So anywhere there's a puncture in the body where some sort of bacteria gets in there, it's going to eventually go into the circulation, the blood. And at some point, there needs to be a checkpoint to catch that bacteria, virus, debris, whatever, to get it out of the body before it reaches the mainframe, which is the heart. So there are primary and secondary lymphoid organs. So red bone marrow is a primary organ. Okay, so in long bones, there's, remember the cavity inside that has bone marrow. okay? But in flat bones, such as the rib, sternum, and pelvis and vertebra, there are areas where there's reserve red bone marrow, okay? And this is going to have a reserve to have the body have extra red blood cells, extra white blood cells, platelets. So it's like a reserve. If the body is under attack, we're going to have backup supplies to come to the battle to actually supply the troops. Then you have your thymus gland is also a primary. This is the small butterfly-shaped gland, okay, located on the superior surface of the heart. So above the heart, superior means above the heart. And this is going to, this is the, if you will, scanning system. So you're coming through TSA, you're going through the scanning machine. It's going to tell, are you part of the squad that works here at the airport, or are you a enemy or civilian or whatever? So it's just kind of like a way for them to recognize this part of the body is myself. This foreign object is not self. And then it's going to be a barracks, if you will, to allow the lymphocytes to mature, to get ready for battle. So then when they're needed, they can be released into the body. Okay. Two secondary organs, spleen. This is the largest lymphatic organ. Remember that, the largest organ on the left side of the abdomen between the 9th and 10th ribs. So this helps trap foreign material and remove damaged and aged red blood cells. It's also a reservoir for red blood cells. So red blood cells, they're born and then they die. So any sort of carcass, if you will, has to be taken up. You use what you can from it, and the rest of it gets thrown out of the body. You just can't have a bunch of dead debris floating in your system. And then if your body needs more red blood cells, it's going to allow more new red blood cells to go back out into society and help with the functions. Also white blood cells and platelets. So your body is constantly on this cycle of creating troops, sending troops to battle, creating troops, sending them to battle. So different parts of your body need to constantly, just like in the US, how we have different bases on the East Coast, West Coast, North, South, we need to have different locations for those troops to be produced, held, created, matured, and then it gets released to where it needs to go. And then lastly, lymph nodes, small bean-shaped lymphoid organs. They're found in clusters like grapes. Okay, so these clusters are going to be in the neck. So cervical is in the neck. Axial means armpit. So you think if I throw an axe, I have to reach my arm up, and my armpit is exposed. Then you have inguinal, means like in the groin region. So you have these major regions, as you can see. You have in the neck, because this is where you have open orifices where you can breathe in debris. You have your axillary in the armpit. Like I said, if you cut your finger, that's going to go straight up towards the heart. So it needs to be caught in these clusters. And then you have clusters in the groin in case you get something coming in your vaginal area, your anal area, or your leg or foot gets cut, and then that debris comes up that way. So different entry points require different amount of troops in that area to help protect that area from it coming to the heart. So in the gastrointestinal tract, nutrient absorption takes place in the ileum. So in the intestinal tract, we have these little fingers called villi that as your food is going through, as all these minerals are going through, this is going to uptake and absorb nutrients and fat. Okay. As these things absorb from your food, you have this waste that is left over. So all that fluid buildup has to be taken into this lymphatic vessel. So not only in your blood system you have debris that can come in, but you can eat something poorly, like eat some bad pork or something, and then it goes into your tract that is a closed tract from your mouth down to your anus. It's a closed tract. It doesn't go. It's not attached to any other organ, in the body. Yes, it can proliferate through the blood system, but everything that is in there that doesn't want to be in there has to be excreted either through the tract itself, or if they're very, very, very small, through this lymphatic vessel. Okay, so back to the spleen. Again, it is the largest lymphatic organ. The spleen is there to detect bacteria, viruses, or other microorganisms in the blood. So this is just like I said, a TSA checkpoint where these things, there's like people behind the computer, kind of like in the tower, making sure that all the cybersecurity is there, like making sure that everything is running, and the lymph nodes are more of like the border control at those little small booths that you kind of go through to like the border. It's like, it's kind of small, like a few little things. So it's like there's different checkpoints there. This, along with the lymph nodes, creates white blood cells, lymphocytes, Luke Skywalkers. Okay, they're the body's defenders to invaders. So humans can live without a spleen, although people who have lost their spleen to disease or injury are more prone to infections because there's less security to overwatch the city.
Does your spleen have something to do with? Does it have something to do with when you drink, it affects your body? Like if you don't have a spleen, if it. What is it? Like when you drink alcohol, does your spleen have anything to do with it? Regulating it, pushing it out, anything?
No, that's more your kidneys.
Right. No, I know somebody who doesn't have a spleen, but ever since he got his spleen taken out, he has drunk super fast. Like he can drink 2 beers and he be full drunk, but it didn't happen until after he got his spleen taken. He just been trying to find a correlation.
I don't know, something with the absorption. The spleen may slow down the absorption of the alcohol somehow.
Mm-hmm.
But if it's there to detect foreign objects, because alcohol is a poison. Mm-hmm. But if you shut down the borders, then people are just walking right across the line. All right, the thymus, small organ, like I said, stores immature lymphocytes. So this is a barracks, if you will, where the troops are in ROTC and they're ready to go in the military, and they're just being prepared to go to boot camp, to train to then go to war. Tonsils, this is our first line of defense because our mouth is the only place where it's an open orifice where we can just breathe in anything. Okay? So kids sticking their mouth on poles and putting sticks in their mouth and all this stuff from the ground. That's why kids can get infections and their tonsils can get inflamed, because they're just putting so much new material in their body, and their immune system doesn't know what this new bacteria is. Even though after a while their body will fight it, and then it will kind of scan that virus or that bacteria and say, oh, next time I got it, I know what it is, I can defend the body. So it's good for kids to constantly do this activity of putting things in their mouth, but sometimes there can be a really bad bacteria that even an adult can't handle, and then it can get overrun. The tonsils can get overrun, and the body's constantly producing white blood cells. And then when you see all this pus is just dead white blood cells that have gone to battle. So it's good that it's there, because it means that the immune system is doing its job. But it's just now we have to boost the body with nutrients, vitamin C, different vitamins, eating natural foods that help boost the system, so that child can, or adult can fight the infection. But it's a good thing knowing that the body is doing its job. It's just having a hard time at the moment. All right, so lymph. This is similar to what lymph looks like. It's a clear and colorless fluid. This one's a little more white. I was trying to find a good picture. But lympha from Latin means connected to water. So this fluid is getting transported all throughout the body, just like if you filled up your toilet with water, you went to the bathroom, you flushed the toilet, that goes through the pipes into the sewage system, into the water plant. It gets bleached and sanitized and cleaned and filtered, and then it comes back into your sink. All right, so plasma leaves the body's cells once it has delivered its nutrients and removed debris. Most of the fluid returns to the venous circulation through tiny blood vessels called venules and continues as venous blood. The remainder of the runoff becomes lymph fluid, gets filtered through the lymph nodes, and then gets pushed back into the venous system. Unlike blood, which flows through the body in a constant loop, lymph flows only up the body towards the neck. So you have lymphatic vessels that are connected to subclavian veins. So sub meaning below, clavian refer to the clavicle. So you have your right and left clavicle. So the vein is right under your clavicle, or collarbone, if you will. And then the fluid re-enters the system. So people that have swelling or edema in the ankles and legs, get the cankles, this fluid is not pumping properly back up the system into the heart, so it's pooling in the ankle. And then when you kind of press on the skin, it feels kind of like jello-y, if you will, because this fluid is not doing its job, or the body is not doing its job to push the fluid back up. It's a matter of time. If that fluid is in there and there's some sort of, they could have a paper cut, and that part of the body can get infected really quickly and become necrotic, because the system is not able to fight the area and remove what it needs to remove. So, a person can go, I don't know, months, years with it being filled, but then you're going to see one person that has like one leg that looks like an elephant, and the other leg looks normal. It's going to slow them down dramatically in their lifestyle, but like, if there's damage, but diabetes usually affects the nerves more and the circulation system. So I guess in turn it could, if the venous system is having a hard time.
I know sometimes with diabetes, like people get their feet amputated or toes or.
That's because the nerves start to die off.
Okay.
Sugar is inflammatory. Sugar being in the system a long time is just damaging and inflammation, and like it's just causing a lot of damage to the body. And people who get to that point don't stop their lifestyle. They're still eating cheesecake and all this stuff. So like they're adding more poison in their body, and their body's just like the alarm's going off, and then eventually the body's kind of like, we tried. I'm doing what I can to keep the core in the body alive. So then, something has to give.
Okay.
All right, diseases and disorders of the lymphatic system. So,
could I stop you? Because I'm trying to come to grips with the term that you're using, this venous system.
the what?
Did you call it a venous system?
Venus.
Yeah, because in the circulatory, the cardio part that we had, that was a venous return, right?
Correct.
Is this anywhere?
Same thing.
It's the same.
Venus, the veins are the blue. The veins is the blood absent of oxygen. So it's red. The blood from the heart has oxygen. Remember the hemoglobin is holding the oxygen.
Yeah.
It gets pumped out of the heart into the system. It goes down to the fingers and toes, drops off oxygen and the nutrients that are going with it. And then it has to come back to the heart to pick up more oxygen. So now it's the blue coming through the venous system. It's like a highway. You don't drive down the same highway to come back home. You go 95 south, 95 north. So same with the system. 95 south is the red blood. 95 north is the blue blood. So when the I guess off ramp and everything intersects, this fluid is still permeating off of the highway, and that water has to go somewhere. It can't flood the highway, so it's got to go into the drain, and then that drain pulls the water up into back into the city again. So what part of Venus are you confused about?
So in this, the lymphatic system is taking all the trash out.
Correct.
But in the other system, it's simply taking the used blood back up so we can get some oxygen and then go back through the heart. But they're not following the same route. They're not going to be on I-95 together, right? Or are they?
Think about your neighborhood. You drive to and fro in your neighborhood, and you got the little manholes there. Under the manhole, there's the sewage system. On the side of the curb, there's the little hole that when it rains, it's going to rain in there, and all the debris from the street is going to go into that system. It's technically not part of the road, but any debris off of the road has to go in somewhere, and it goes into this kind of pool underneath the road, and then that gets pulled into pipes that go into the power plant. Right? So interstitial means in between the tissues. All the water that is splashing off of the ground by the mailbox, all the puddles and things everywhere, all that, once it floods up enough, then it runs into a drain.
In between the vessels? What is the interstitial?
In between the tissues. So do you know what a soaker hose is?
Oh,
A soaker hose.
what is that like? Some little kids play with?
Mm.
Oh.
In gardening, there's a hose called a soaker hose.
It just lets out water, not just coming through the spout, but throughout the hose too.
Yes, kind of like if you had a can of Coke and you had the condensation, it would purposefully make condensation to drip, 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 drip out of the side. It's not squirting out; it's just doing it slow enough so there's a constant wetness in the soil to keep the plants there.
Yeah.
So this is what happens when the venous system pushes blood through. All that lymphatic fluid, because it's a high pressure, it's gonna bead off. But then once it fills up out here, it's got to go somewhere. Like this is skin and fat and like all these different tissues are out here. So this has to be drained somewhere. So then you have interwoven, like sewage pipes, if you will, and they have little doors, little like flaps. So once the pressure builds up enough, that flap opens and then it drains. Then it closes again. Then it fills up, opens and it drains. Make sense?
I see it better.
All right. So lymphatic systems, in the lymphatic system, when there's an enlargement of the lymph node, it's known as lymphadenopathy. So pathy means like something is going on with the pathway. Okay, so the pathway of the fluid going through, it getting filtered, it getting cleaned, it's blocked. Okay. So lymph meaning lymph, adeno meaning the gland, and then pathy meaning the pathway. So this is due to a lymph node blockage. When it's blocked and swollen, then it's going to be lymphedema. Edema means to swell. Okay. This could be benign, but it also could be cancerous as well. So if it gets too large, then they might take a look at it and see is it some sort of cancer or is it just the body fighting itself? Okay. Down here, you see one leg is swollen than the other one. There's some sort of damage or blockage of the system. So just like I was saying about the venous system, how there's like flaps to keep the blood going in one direction from the heart. There's flaps to keep this fluid going up in one direction, and then it closes off, up and closes off. If there's damage or weakness or sedentary lifestyle where these skeletal muscles aren't squeezing like a sponge and pumping this fluid back up, then it's going to all pull down below.
So that's what elephantitis is.
Elephantitis is a different condition. This condition is just fluid buildup where it can cause one area to mimic an elephant leg. But this is like just with fluid.
And can that be relieved?
It can be relieved if there's damage, then lymphatic drainage can be pushed to bypass it to other lymph nodes. If there's an infection, the infection has to be taken care of first, and then it can be pushed out. Sometimes, especially in the upper extremity, if women have breast cancer and they have some sort of surgery and they damage those lymph nodes, then there's constant swelling. So they have to wear compression sleeves. There's like a sleeve machine, if you will, that goes on and it squeezes and it pumps it out. There's lymphatic drainage, but it's going to be a constant daily thing to do. But for the most part, if the vessels are intact and there's no damage and it's just some sort of infection, if that infection can be controlled, then you can restore function to the area.
Is there damage? They have to do that for the rest of their life?
Yes.
Ooh.
So lymphadenopathy is usually caused by an infection, inflammation, or cancer. Okay, so bacteria comes into the body through a skin wound, is infected, or a viral infection. Somebody gets mono, some sort of inflammatory condition where the person's immune system is too hyperactive, and it causes a large enlargement of the lymph node itself. So if the body is like on high alert and it's just like it's doing so much at one time, then that area can get overrun and filled up. Because imagine if your body is fighting off fires at every corner of the neighborhood, it can't really focus on the one main fire right here in the city. So if you get a cut in the ankle and this bacteria goes up, this lymph node might have already sent out troops and it's still replenishing its troops. So it doesn't have enough to fight off this enemy, and then that station gets overrun. And then it moves to the next station, moves to the next station. So it's just like, usually these type of issues happen when people already have a compromised immune system, not a normal, healthy person. So lymphedema and edema is a swelling from abnormal accumulation of fluids within the interstitial spaces, in between the cells. You have different stages. It starts out where it just starts to drip and go into the spaces, and then you can see stage 2, stage 3, stage 4. This fluid just constantly fills, just like if all the roads were blocked and then you have like a drizzle over a week period of time. Eventually that water is going to rise and it's not running off. You have two classifications of lymphedema. It's primary and secondary. Okay, so primary is inherited. It's more of a condition from birth that can show at birth or show later in life. Okay, so there's some sort of deficiency where when your lymphatic system is not working properly. You could have abnormal kind of lymph nodes that are misshapen, or you have missing lymph nodes or lymph vessels that don't work properly, that can transport the fluid back up into the system, or drain the fluid properly. So some sort of technical malfunction of the blueprint itself, the scaffolding. So examples of primary is Milroy's disease. So this begins at birth when you're an infant. Meig's disease. This shows up during puberty or pregnancy, and sometimes later in life, but usually in these two cases. And then you have late onset edema, where it happens after 35. Secondary is brought on from another condition or disease, which causes permanent damage to the lymphatic system.
That's what secondary means when you're talking about any type of like medical diseases together. They'll say something second, and I think I'll come think on it. Just like how you said it, they're like secondary, blah 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 blah, which means that it was caused by something else.
Correct.
Okay.
This often occurs from cancer treatments, lymph node removal, and irradiation. cancer, trauma, injury, or infection. So like I said before, if somebody has breast cancer, they get radiation, that doesn't work. Then they have to actually remove the breast tissue. They have to cut through the underarm, which during surgery, they may cut through different lymph nodes, and depending on how many lymph nodes they damage through that, then it's going to cause this swelling. Because you can't really make a giant incision in the front of the chest because you don't want to leave a giant scar. So they want to go in areas where it's going to do minimal, I guess, scarring visually. But then going in that area, there's just so many lymph nodes in there. It's hard not to affect that. Also, the cancer is direct radiation to the area, and you could be damaging, shutting down, killing lymph nodes that way, depending on how much radiation is being involved. So surgery, taking out lymph nodes or injury to the vessels, like I said, radiation, and then cancer, you have tumors that actually block the pathway, causing plugging the hole of the system. Trauma or infection as well. So edema is just swelling from an imbalance of fluids in the body. So the fluids are being distributed unevenly. So this doesn't always necessarily mean that there's some sort of damage. There is just the fluid is going to an area where it's not supposed to go, and it's not being pulled back. So I had a client who she worked from home, and she worked like maybe 12, 13-hour days. She was a larger woman, and instead of working at the desk, she wanted to work at a bar's top because it was a more appealing environment in the home. But the high bar top stool, her feet would hang down, and the bottom of the seat would press right up behind her knee. And she would be there for hours at a time, not walking around, not taking breaks. And then she'd come in and she'd have this edema going on, and she'd be confused on why it's swelling, So I'm trying to work with her and help her understand that to use the feet and the legs and the calves and muscles to squeeze that fluid back up, first you have to unkink the hose, stand up and walk and move, and allow that fluid to be pumped back. So just sitting there, it's just gravity's pulling everything down to the bottom. So common signs of peripheral edema include an arm or leg starts to feel heavy or full. Like I said, sometimes you don't notice a huge difference. You just feel like, wow, like this part of the body just feels a bit more heavy. And then it starts to swell, and you notice it's swelling. When you press it, it leaves a dent. So you press it, it leaves a fingerprint, and then it slowly fills back in again. Clothing or jewelry starts to feel tight and uncomfortable. Skin near the area of edema becomes tight or warm. It becomes harder to move your joints that are affected. And the body just feels really tight and stretched around the area, sometimes causing pain. So the larger people are used to being puffy and swollen, and sometimes depending on the diet that they're eating, there's already a sense of inflammation and gastrointestinal distress that they might not notice a part of the body swelling until it gets so large, because they already just have a lot of adipose and a lot of inflammation. So these other signs of it feeling warm to the area, it feeling very, very achy, or the skin feeling very stiff, that those can be other signs versus just a visual appearance of edema. So edema can be mild and temporary water retention that goes away by itself. It could be a symptom of a serious disease that needs treatment. It can also become chronic and severe, like lymphedema after a cancer treatment, or leg edema in one leg following deep vein thrombosis. So deep vein thrombosis, a thrombocyte is like a clot of platelets, and this can actually travel and block one of the valves, and then that fluid can't go back up because of that blockage. Or a adverse side of medication, or a reaction to some sort of allergy. So what this means for you, if you notice a client with lymphedema and you have the special training or skills to do manual lymphatic drainage, then you can work the affected areas, or you can notice that they have these conditions and then refer to another practitioner.
Do you do lymphatic drainage
Do I?
in the blood?
We don't, because
That's one of the things to ask you for.
it's a very special.
Yeah.
Yeah.
No. I'll still share it. It's almost done. I'll still share it to everybody.
Okay.
I think I got most of it done. I gotta go.
All right. So there are 4 types of lymphatic drainage techniques. Vader, I think, is the most used one, but there's Vader, Foldy, Casey Smith, Leduc. So these are just different people that have created, I guess, a course or a system to deal with this condition.
Mm-hmm. So in Europe, let me let you finish.
So systemic lupus, this is going to be a inflammatory disease where the body it's doing so much inside of the body with the immune system that it can sometimes detect its own self, if you will, like I said, as the enemy. So it starts to just have battles all over the place, and it's kind of hard to know what's friendly fire and what's firing at the enemy. But this is I think also more of a nervous system condition where the communication in the body from the brain to the different systems, something is not going properly. So there's this like miscommunication going on. But it's not as easy to say that, oh, the body is confused, it's attacking itself. There's reasons why the body is not communicating. So looking past the lymphatic system into the nervous system and seeing what is going on, where is there this miscommunication. But I mean, this is obviously outside of your scope of practice, but it's just something to think about, to kind of inquire questions with them of like, what kind of treatment are they having? But yeah, this can happen, and this is part of the lymphatic system of it just being so inflamed. So if there's a flare up, you can't work on them. Obviously, if their skin is flared up and it's irritated, they're not going to want to be touched anyway and come in for a massage. But during periods of remission where it's kind of down and it's not as irritated, they're going to come in probably to get a massage, but just being gentle.
Massaging the lymph nodes help the disorder.
No,
Is that right?
this is just for the skin condition.
Okay. But don't people with lupus on their body be hurting and stuff like that? Do they have like sore bones? What's on? I know they can.
Yeah, so that's what I'm saying. During periods of remission, remission means,
Yeah, when the not got it in.
yeah,
When the feeling level.
correct. You can work on them gently, but you have to avoid the patches of the rash. And then lymphoma refers to cancer. So OMA, anything OMA attached to it is going to be something dealing with cancer. And this starts with, it'll be a cancerous thing in the lymph node, in the neck and cervical area, and then it'll spread around the body. And then stage 4, it's pretty bad. Lymphoma. So you have Hodgkin's lymphoma and you have non-Hodgkin's lymphoma. So the difference between the two of these is that Hodgkin lymphoma is marked by the presence of these specific cells called Reed-Sternberg cells. So you can just see them under a microscope. Oh, there's a cell. So now it's in the category of Hodgkin lymphoma. And then if you don't see these cells, then it's going to be in the category of non-Hodgkin lymphoma. Okay. So these cells, they're going to be large, abnormal white blood cells that contain more than one nucleus. So if you ever crack open an egg and it's got 2 yolks in it, like, oh, that's a Reed-Sternberg cell. So now this is categorized in Hodgkin lymphoma. Okay. So a person that has surgery, radiation to remove the cancer, the lymphatic flow back to the heart can result in swelling or edema in the area, like I said. Goes over the breast cancer, like I said. The more nodes that are removed or affected, it causes more swelling in the arm, obviously, because there's more backup of the fluids. Chronic fatigue syndrome, also called myalgic encephalomyelitis.
No, you said myalgia. Is that like fibromyalgia?
Close, but this is chronic fatigue syndrome. This is a different condition.
What is myalgia?
I don't remember. I gotta look it up. But this is unexplained prolonged fatigue that is worsened by exertion. So the more they move in the day, the more they're going to get more fatigue. They're going to have brain fog. They're going to be kind of confused. So if this happens more than 6 months, then it's considered this condition.
And this is a part of the lymphoma? Or that's just the diagram still there?
What's that?
Or the diagram's just still there?
It's just still there, yeah.
Okay.
No, it's not one of those folders.
It's a way to cure it or the fatigue syndrome?
As of right now, no, because a syndrome just means a collection of symptoms that are showing the same patterns, but it's unknown of what's causing it.
Okay.
So this is going to cause an imbalance in the immune function, which is going to cause an imbalance in the lymphatic system because it's part of the immune system to fight infection. So a person can get more swelling, more infections. It's going to compromise their body's defense system. So just being aware that a client with this condition can be dizzy, lightheaded while sitting or standing up. So have them sit up slowly and then get up. You might want to push a chair close to the table where they can grab it and hang on to it. So there's a condition called orthostatic hypotension, where ortho meaning bone, static means still. So once they stand up straight, their bones go up straight, their blood pressure drops, and then they can pass out and hit their head. So just have them sit still, even if they have no signs of being fatigued. If you see this on the chart, just say, hey, take your time getting up, no rush, just sit up for a minute. Here's a chair, whatever. And just kind of like, just be wary, because you might hear a thump and then they hit their head, and that's a problem because they're thinking, oh, this person has to go to the next client. I'm going to hurry up and go. You know, like some people just they're thinking about you more than themselves, and they're rushing to get out of there. So just helping them, hey, take your time, be easy. Okay, so the majority of the large lymph nodes are not dangerous, so don't freak out about them. Like I said, they're just a way of the body's way to fight infection. If there's a viral infection in the upper portion of the system, there's going to be swelling. They can be enlarged, but then they can go down. So avoid them, don't rub on them, but just don't freak out if somebody comes in with some enlarged lymph nodes. Typically, these nodes don't become larger than a centimeter, but if you notice that they are getting very large, then you want to just say, hey, have you seen your doctor about these lymph nodes? I'm noticing that there's some lymph nodes here. Maybe they have, maybe they were so busy they didn't even notice. Thanks so much. Then they go see their doctor and get it checked out. So you're the kind of first line of defense of like, I'm noticing there's swelling. I'm noticing there's this rash on your back. I'm noticing this thing, saying, have you checked with your doctor about these conditions? Okay, so if they start coming in with their arms swollen or the groin swollen, or they lose a lot of weight, or they're having fever and night sweats, because you usually ask them, how are you sleeping and what's going on new? They're like, yeah, I'm just like sweating at night and all that stuff. But if they're like not even close to menopause, you're like, this is interesting, so just asking questions and saying, this sounds like, it could be something going on. You can't diagnose them. Just say, I think you need to go talk to your physician about these symptoms to make sure that it's not something serious.